Welcome to the Certification Practice channel. We offer realistic, expert-created practice exams for the CNA Certified Nursing Assistant exam, all verified against official documentation. Our platform at certificationpractice.com is free to use, so you can test your readiness anytime during your prep. Here's something that catches many CNA candidates off guard. This exam has two separate components you must pass, and they test you in fundamentally different ways. The written portion checks your knowledge, but the skills evaluation watches you physically perform care tasks with an evaluator observing every move. Fail either one, and you don't certify. Stay with me to the end, and I'll show you how to approach both portions so nothing surprises you on test day. Let me give you something useful right now. During the skills evaluation, you'll perform hand hygiene plus 4 randomly selected tasks from 23 procedures. Each skill has critical element steps, and missing even one means failing that skill. When you practice, memorize the exact sequence and elements that cannot be skipped. Physical care skills make up 64% of your written exam. This covers activities of daily living like bathing, feeding, and toileting, plus basic nursing skills including infection control and vital signs. The exam loves scenario questions where you identify correct order of care or recognize when something needs reporting to the nurse. Another key insight: the written exam has 70 questions, but 10 are pre-test questions that don't count. You won't know which ones, so treat every question seriously. You have 2 hours, meaning you can think through scenarios carefully. Understand scope of practice questions. The exam frequently tests what falls within your responsibilities versus what requires a nurse. When a question asks what you should do first, and one option involves notifying the nurse about something abnormal, that's often correct. CNAs observe and report. We don't diagnose. So far, you've learned about the dual exam structure and physical care focus. Now let's cover what trips people up. Psychosocial care only accounts for 10%, but candidates underperform here because they dismiss it as common sense. These questions test specific approaches to emotional support and cultural sensitivity. When a client is confused or agitated, choose responses that maintain calm and respect autonomy. The role of the nurse aide covers 26%, including communication, client rights, and ethics. Pay attention to confidentiality scenarios and suspected abuse situations. The exam tests mandatory reporting requirements. For the skills evaluation, you have 30 minutes for all 5 tasks. Practice with a timer. Verbalize what you're doing as you practice to build the habit of demonstrating knowledge to the evaluator. On exam day, bring your original Social Security card, government-issued photo ID, training completion form, 2 No. 2 pencils, non-skid shoes, and a watch with a second hand. Remember the 2 components that both require passing? For the written portion, focus study time proportionally on physical care skills first, then nurse aide role, then psychosocial care. For skills evaluation, practice every procedure until critical steps become automatic. Candidates who pass first attempt share one trait. They practice physical skills until they perform them correctly without thinking, freeing mental energy to stay calm during evaluation. To test where you stand, we have practice exams for the CNA certification at certificationpractice.com. They're aligned with actual exam content, kept current, and free to use. Good luck with your preparation.